Welcome to the webinar, everyone. So in this webinar, we're going to talk about anti-aging. I want to teach you some great things to actually reverse the aging process. Is it possible? I think it is. I've been working with a lot of people over the years, and I found that they do get younger as they get healthier. So the goal is to make you younger every year that you age. So that would be cool. I'm going to just go to some slides right now. Let me just share my screen here. Make sure you can see everything. Okay, so here's the thing. When we talk about anti-aging, if you do research on the internet, you're going to see there's a lot of information about just skin creams, taking vitamins, looking good on the outside, using different facial scrubs and that type of thing. But there's a lot more to anti-aging than just the superficial putting a cream on your face to try to get rid of wrinkles. So we're going to talk about two things. One is how to look youthful as you get older, but we're also going to talk about the heart of anti-aging, which is to postpone your life, to prevent dying at an early age. We're going to talk about that because it makes no sense to try to look young while you get cancer and drop dead of a heart attack. So I want to cover both things today, and I wanted to mention that one of the things that I really emphasize is to increase a health reserve, to build up kind of a health insurance reserve. And there is a test that can be measured to look at the internal health reserve. And I have one of my patients that we just today were evaluating. We're looking at her health reserve and trying to build that up. And I just want to kind of show you this little graph here. You can see there's this taller dial and a small dial. The tall dial should be straight up and down, and the small dial should be all the way to the right. So if the small dial goes to the left, that's an indication that the person is losing their recovery reserve. And I look at that as kind of like the deeper health reserve. This test, just to keep it really simple without giving you a lot of big words, is it's called heart rate variability. It's a test that measures the data in between the heartbeats. It measures how elastic the heart is. It measures how the heartbeat varies from one beat to another. And it's one of the best indicators of overall mortality from heart attacks. So I don't use it for that, but it will give a prediction on how healthy you are overall, but also for the heart. The reason I'm bringing this up is because I've probably taken 10,000 of these graphs, and there has only been one person that has ever had a perfect graph, and he was 80 years old. And I'm like, who is this guy? He was walking down the street with his dog. He falls in a hole, knocks himself out. He lays there for 3 hours, knocked out, unconscious, wakes up, his head's bleeding, goes back home. He has a stiff neck. He sees me 3 days later. His wounds are almost healed. He has a slight stiffness in his neck. So he had a perfect graph. And I'm like, who the heck is this guy? So apparently, when he was younger, he took the Olympics in water polo. And he's maintained his health ever since that. So he could basically hold his breath 3.5 minutes underwater at this point. So out of all the things, all the workouts, all the sports events, I would say that water polo is probably the most incredibly difficult. I almost drowned trying to do this sport in college with my roommate who was into water polo. He would just hold me underneath water until I let go of the ball, and he would anchor his foot into the drain pipe until I cooperated. So it's an intense workout. So in other words, I'm trying to just let you know that it is possible to measure your health reserve, and it is possible to improve it. So let me go to the next slide here. So I think we should probably start this whole webinar by isolating what are the top causes of death. If you look it up, they'll go ahead and tell you on WebMD, it's the heart disease, cancer, chronic respiratory, accident, stroke, Alzheimer's, diabetes, influenza, pneumonia, nephritis, that's kidney problems, and then suicide. So those are the top causes of death. But they forgot to mention one big cause of death, and that's probably the number one. It is not probably, it is the number one cause of death, and that is conventional medicine. Now, in the next slide, you can look at the links because I'll send everyone these PDF files. But the point is that over 700,000 people a year die of reactions to prescription drugs, unnecessary antibiotics, unnecessary medical procedures, hospitalizations. So that actually ranks number one. So I guess the best therapy is to avoid doctors if you want to live longer. Probably, the question is how many people actually died of vitamins? In 2010, not one person. In 2004, there was 3 people who died of mega doses of vitamin D and vitamin E, but I would mention they're synthetic. And of course, the one person died as a result of overdose of iron and fluoride, but I don't consider fluoride a nutrient. So there's been a huge push, by certain people to pretty much make alternative care dangerous. It's quackery, it's scams. But I personally think it's just a way to camouflage like their own secrets or skeletons, because the amount of medication that's pumped in young children nowadays, even psych drugs that they're pushing in the soldiers, and there's 23 suicides every single day in the military, and that's from the side effects from psychiatric medication. So I wanted to just share a story by a client. She told me today, can you tell us what happened? You basically went to the doctor and you wanted some help, and you started to, you had a whole list of problems because we're working with you, but there's some other issues that you wanted to kind of evaluate. Can you just tell us a little bit about, you walked in there and you saw the nurse, and what was the first thing that she said?
Well, first she asked me what I was there for. So I said, well, I have a list of things, and I had some symptoms going on, so I'd been keeping track of them and writing them all down, and I started listing them off to her, and she looked at me like I was crazy, and she said, ma'am, you're going to need to pick the top 2 because she's not going to have time to deal with all of those issues.
So that's
I was a little shocked.
Yeah, it's like when you go to the doctor, you have a list of problems. All those are connected. They're not separate problems.
Yes, and that's what I tried to tell her. I said, no, the doctor's going to need to listen to me because these are all connected, and I need her to help me figure out what is going on. So she left the room sort of hurriedly, acting very almost rude. But when the doctor came in, I did make her sit there and listen to me with every single one of my symptoms because they are all connected, like you and I spoke today.
Yeah, and so one of the things that what's lacking in healthcare, look at this. You got the top cause of death is over medicated patients, unnecessary procedures. Everything has become so specialized into, if you have a digestive problem, you go to this doctor, endocrine problem, you go over here, but they're not looking at the whole picture. I think even with you had, I think you had some history of panic attacks or something, or anxiety.
Yes.
And what do they say about that?
So I talked to her about that and told her that I have been having some panic attacks. She basically said, okay, so here's a script for you to go to the psychiatrist. And I did go to the psychiatrist, and they said, okay, well, here's some lorazepam, or I don't remember what it was. And, there wasn't any, let's talk about why you're having panic attacks or what might be going on. It was, well, here's this medicine, go ahead and take it. So it was very disheartening and frustrating.
Yeah, Yeah, I know. It's you want someone to listen to you, to evaluate, to come up with some solutions. Um, and then I think you eventually saw the doctor, right?
Hmm.
Did he really, what did he do? Did he say about
Um,
your,
okay, so as I went through my list of symptoms, it was a woman. She says, "Okay, so you're having some panic attacks and feeling like this. So here's your referral to go to see the psychiatrist. And oh, you're having hot flashes. Okay, here's your referral to go to the gynecologist. And oh, you're having some joint pain. Here's your referral to in your hip and your back. So here's your referral to go get some X-rays done. Um, oh, you're having constipation. So take some fiber thing, or what I mean. It just, she was treating each one of the things um as a symptom, as opposed to looking at everything that's going on with me as a whole, that there might be something happening. She just singled each of them out and sent me to other places and tried to treat each symptom individually.
yeah, and that's why I wanted to do this webinar, just to give you guys some real basic things. I mean, even one thing with you with your hip, I did
Yeah.
some muscle testing. I found out, I asked you a question. I said, do you cross your leg a lot on one side? And yes, you do. I
Yes.
mean, you constantly do that. And then that's the muscle that is weak because you keep crossing it and throws off the pelvis.
Right.
So some of these things are really, really, really obvious, but the problem is those are the sometimes hardest to identify. So I wanted to get through, so I'm going to come back to that point, but I want to just go through a couple things um, about the third leading cause of death. Since we're trying to live longer, because I kind of protest getting old. I don't want to get old. I know it's inevitable, but I want to slow it down. Um, but it's important to kind of know what people die of. The third leading cause of death after heart disease and cancer is psychiatric medications. I didn't even know that. I looked that up. Um, and this is in the cancer in USA and Europe, over 500,000 people die of either suicide or psychiatric medication, the reactions to that. I think that's why the drug companies are being sued by the billions. So there's a lot of corruption going on with psychiatric drugs in the military, all over the place. And then you have this guy, Stephen Beret, whatever his name is, on Quack Watch, which basically says, he says most diseases have little to nothing to do with diet. It's not, and he goes into saying that it's most things are placebo. Don't take vitamins. Alternative practitioners oversimplify. He says when they say that milling, that's like grinding a grain, removes the B vitamins, they don't bother to tell you the enrichment puts them back. So you can see that here is a person who is very anti-natural vitamins. He's a psychiatrist, which causes the third leading cause of death.
Hmm.
So it's just a joke. So the philosophy that I wanted to teach you guys today is really going beyond the outside in and going the inside out, working on the inside of your body if you want the entire body to look youthful. I think probably one of the biggest industries out there is skincare and makeup and hair care, and it's all just superficial. You're just dealing with a very tiny layer on the outside of your body. There is much better things to do to get the skin youthful, prevent wrinkles, and I'm going to cover what you need to do. A better strategy would be to just really look at the quality of materials that you're putting in your mouth and you're digesting. I will say that certain parts of your body are replaced at different rates. For example, like your skin cells sometimes are replaced every 4 days. The liver is replaced every 3 years. So the red blood cells are replaced every 4 months. The colon cells are replaced every 3 days. So you're constantly replacing your cells. And the question is, what are you replacing them with?
Mm.
I'm going to show you the best material to replace them with. But there's one thing that doesn't rejuvenate or doesn't replace itself, and that's the brain. So once you kill off your brain cells, you don't replace them. They don't come back. So what I want to do is I want to ask everyone who's on the webinar a question. What food, and I'm going to just make this, what is the food that gives us the highest nutrient value? Okay, it's a category of foods. And I want you to go ahead and, I'm looking at your answers right now. I want you to take a wild guess. What category of food gives you the highest amount of nutrition out of all food categories?
Mm.
I'm going to give you a second to answer that. Kale, leafy greens, vegetables, kale, veggies, plants, protein, fats, veggies, protein. Okay, well, this is interesting because this is something that's kind of unknown. Yeah, berries. No. I always like that when you ask a question. I'll do a seminar, I'll ask a question, I'll say, okay, does anyone know this? And you know they're not going to know it. So you just, no, that's not right. So you're wrong, you're wrong, you're wrong. So what about you? Do you have any idea what, Leslie, what the highest nutrient food is on the planet that you can get all of your nutrition?
I should know this, huh? I'm thinking, I'm thinking fat. I don't know why, but
Okay.
I could be wrong.
Okay. All right. Let me.
I mean, I'm reading all the things on the side. Everybody's saying good stuff.
Yeah. Well,
but I'm not sure that one thing. I'm not sure what the one thing would be.
Okay. So now I'm going to tell you. It is. I thought I had a slide on it, but I don't. Organ meats.
Organ meats. Okay.
Yeah. Liver, heart,
Yeah.
brains, kidneys. Personally, I can't eat those foods. I just can't eat them. I think as a child, I was forced to eat liver, and I just can't eat it. I don't know. I have a hard time eating brains and kidneys, but I'm just letting you know, those foods, I know a lot of them are toxic because of the animal feeds, but I'm just telling you, as far as the nutrients that are in those foods, like it's really hard to find one food that has all the nutrients. But there is one food that has all the nutrients, and that would be the organ meats. So if you like liver and you have an organic or free range, animal, and you consume that, you will get a lot of nutrition, especially like iron. And there is one type of nutrient, types of nutrients that are better for looking young than others, and that would be the fat soluble vitamins. And that would be like vitamin A, D, E, K. Those vitamins, yes, they're in vegetables, but they're actually in vegetables, they're pre-vitamins. So in other words, they have to convert into the active form. And you have to have a good digestive system to consume that. So you may, if you're lucky, convert about 5% of those true fat soluble vitamins to help the vision, to the skin, even vitamin A for your skin. If you don't have vitamin A, you actually dry out your skin, and you actually look older. Going on a low-fat diet is very, very bad for anti-aging. So let's go into some of the foods or the nutrients that will help you stay younger or look younger. The first thing I want to talk about is foods for collagen support. What is collagen? Collagen is like the glue that holds the body together. It's it's in the joints, it's in the skin. If you lose collagen, your skin gets thin and it sags, and you get wrinkles and you look older. So you can consume the collagen itself, or bone broth, or grass-fed animal products. But you also need trace minerals to actually utilize that collagen. You also need vitamin C to use the collagen. So I wanted to show you something. This is a grass-fed collagen that I got online, Great Lakes Gelatin. I mean, it's good if you have like a lot of joint problems, arthritis, and you don't consume a lot of animal products, especially grass-fed. That would be something you can try. But I found that most people are not really deficient in collagen. It's not something that they're not eating. That's not why they're losing their collagen. I'll get to the why, but the point is that it's not a bad supplement to take. But just by taking this does not mean your skin's going to look youthful. You need several things to make that work. The big thing is trace minerals. These trace minerals are not in the soils. I've done seminars on trace minerals. Here's a version I use trace minerals. It's a plant-based. It's not sea salt. Plant-based minerals are 15,000 times smaller than regular minerals, so they go in like a rocket ship. So you need the minerals. You also need the vitamin C complexes. And I wanted to show you a food that's very high in vitamin C. But I want to first find out, I want to ask you, what foods are high in vitamin C? What are the top 3 foods that are the highest in vitamin C? Let's see who can get that one right. Okay, people are saying camu. Yeah, that's a great citrus, carrots, broccoli, kale, spinach. So you guys are doing pretty good on that one. So I think you got that one down. The 3 foods that are the highest in vitamin C, which would be number 1, papaya, number 2, kiwi, and number 3, peppers. Now, these are not from the grocery store. These are from the farmer's market. These are freaking amazing peppers. They're crunchy. They're loaded with vitamin C. And vitamin C, you got to be careful about vitamin C because most of it is synthetic. And I'm talking about ascorbic acid. If you buy vitamin C and it has over 100 milligrams of ascorbic acid, it's just synthetic. They make ascorbic acid from cornstarch, which has no vitamin C, and sulfuric acid. And you take this stuff, you're not getting any of the vitamin C complex. It's not going to help your collagen. If you do something like this, you're going to get the complete complex, because in the complete version of vitamin C, you have enzymes, a copper enzyme called tyrosinase. You have the J factor, the bioflavonoids, the rutins, all the different great complexes for vitamin C to help build collagen. And organic copper, it's a mineral in that thing, and so it's and by the way, a lot of the vitamin C is stored in your adrenal glands. So if the adrenal glands are tired, you won't have enough vitamin C to use that. And the other thing is that when you take vitamin C in high dosages in synthetic versions, it will create deficiencies of the other factors of vitamin C, causing spider veins. And I'm going to talk more about this in the next seminar, but Linus Pauling recommend large dose of vitamin C. You ever notice he has these spider veins around his nose? That's a vitamin C deficiency, because one of the side effects of scurvy is microhemorrhaging of the capillary beds. And so the bleeding gums, the spongy gums that you have when you brush your teeth, that's a vitamin C deficiency. So, and also fatigue is a vitamin C deficiency. But also the arteries can, in high pressure areas, have a microhemorrhage, and so the body puts a Band-Aid on it called cholesterol and calcium plaquing, and that's what makes the clogged artery. But the first thing that happens is the microhemorrhage from the vitamin C complex deficiency. So those are some vitamin C things that you can look at, and especially for your skin. I mean, you need that collagen. So now I'm going to go back to my slide, if I can do a screen share. Let me see here. Okay, so we have collagen bone broth. If you took an let's say some bones from let's say a cow or something, and it was grass-fed, and you were to cook it, over a day or two and make some bone broth, and there's a great recipe, that would not be a bad idea to drink that stuff. It's really good for collagen, especially if you want really strong nails and hair. I can actually, if I can either use trace minerals to make hair stop falling out, or sometimes collagen, or the combination of both, but because trace minerals also help the collagen form correctly, so the combination is very, very important, especially for hair loss. So the most important thing to do is to make sure that your animal meats are grass-fed. And I'm going to show you, I use, like here's an example. I do a lot of beef myself. This is grass-fed. And the reason why I do grass-fed is because it has loaded with vitamin K2. If you've seen any of my videos, you basically know about K2. It's going to be the next super vitamin. It improves elasticity of the arteries. It decreases blood pressure. It gets calcium out of the joints. It's quite amazing. And of course, we have the grass-fed Kerrygold butter. That's vitamin K. It's loaded with vitamin A. And of course, I'm showing all my food here. These are my eggs from the farmer's market, from a farmer that basically, I have a video. I'm going to put a video of this farmer because he has these cages in the grass field, in the clover fields, and they're like the human lawnmower. They will eat all this grass, and then he rotates them. I mean, talk about a pasture-raised, grass-fed chicken. I mean, those things are, those eggs, it's hard to even break the shell. It's so loaded with calcium. So it's quite amazing. There's a couple questions. I want to just go right to the questions. Said the webinar keeps cutting out. No worries. I'm going to record this and I'll send you the link right when I get done. What about fermented cabbage? I love it. I think that's a great idea. And cabbage is really huge in vitamin C, and has the complete complex. Can spider veins be repaired by taking proper amounts of vitamin C? Well, I wouldn't worry about the amounts. I would worry about the type of vitamin C that you consume. And yes, it can be reversed if you have the whole complex. Just make sure you do not consume ascorbic acid. Let's see what else. Grapefruit has some vitamin C, but it's a bit too sweet if you're trying to lose weight. I always have to talk about that because fruit tends to slow down weight loss. Okay, good. What if you have autoimmune and can't do nightshades? Well, then you can use the, there's camu is a great vitamin C complex. You can do that. There's a lot of other things that you can do other than the nightshades. Not a problem. Okay. So there's three things for collagen support. One is you possibly might need collagen. You might need trace minerals, and you might need to support your stomach, because if your stomach has, if you have like acid reflux, or you have bloating or burping, and you don't have enough acid, that could be the reason why you can't digest protein. And collagen is, your stomach has to be really, really acid to trigger those enzymes in the stomach to break down collagen. So as you get older, especially during menopause, you lose your stomach acids. So if I were trying to improve my collagen, and I was female, and I was menopausal, the first thing I would do before anything is I would make sure that I correct that digestive stomach pH. So if I had like indigestion or acid reflux or heartburn, that means that I would have to add more acid to that stomach to correct it so the valve gets closed. It's called betaine hydrochloride. So if you're listening now and you have any digestive issues at all, take some betaine hydrochloride, maybe 3 with a meal, get it from the health food store, and then within a week or two, watch what happens to your hair, nails, and skin. It will improve because you'll start absorbing more of the collagen from the food you're already eating. So we just have to look at those factors. The next thing I want to talk about is very important, and this is for those people that want to change not just their health, but the looking youthful, and that would be the fat soluble vitamins and all the oils. You don't want to go crazy. You have to be able to digest them. You need to have a good gallbladder to digest them. But the point is that when people are pushing the low-fat stuff, that's when you start looking older. You want to look at the shelf and get whole fat, not low-fat anything. So if you're going to do some yogurt, make sure it's whole fat. Of course, you got to watch out for the sugars in yogurt nowadays. So there is not a problem using the butter. It's good for the skin because it contains vitamin A. So the first vitamin I'm going to talk about is vitamin A, and that is in egg yolks, grass-fed butter, shrimp, cheese, sardines, tuna. It's in fish. It's in all the fatty stuff. I'll show you something here. What was I going to show? Oh yeah, cheese. I'm from Wisconsin, so I love cheese. And of course, Kerrygold. Here we go, Kerrygold butter, Kerrygold cheese. This is my favorite cheese right here. It's at BJ's in Costco now. I can't believe it. It's all grass-fed. Here's another grass-fed cheese from Trader Joe's. I do a lot of cheese. That has the vitamin K, it has the vitamin A, even some vitamin D. Those are fat-soluble vitamins that you need for your skin, for your hair, to prevent wrinkles. So those are things that'll really, really help you. And take them from the inside. Don't rub the butter on the outside of your skin. That's not going to do it. I used to crave butter as a kid. I used to eat it. Of course, I had no idea why. Now I know why. I was deficient in vitamin A. So vitamin A, it's in these fattier type things that you were told to avoid. So the other thing you can do is coconut oil. You can cook with it. You can eat it. Fish oils. The best fish oil that you can have is either krill or cod liver oil. Yes, your grandmother was correct. Cod liver oil has a wonderful blend of vitamin A and vitamin D. So I would start consuming. You don't need a lot of it, you just need a little bit of it. Okay? Now let's talk about vitamin E. Why is vitamin E important? You've heard vitamin E for scarring, for skin health, for sex hormones. Vitamin E is a precursor for hormones, and it's stored in the pituitary. When women go through menopause, they don't use their ovaries very much anymore. So they're not going to have babies. So what happens is that dynamic, that pituitary release every month is no longer has to work as hard. So the vitamin E reserve tends to dry up in a lot of women, and I find they end up with a vitamin E deficiency and they start getting unnecessary wrinkles. So if I were you, what I would do is don't be afraid to start consuming some of these fats, but the foods that are highest in vitamin E are almonds, other nuts, sunflower seeds, very high, but they have to be raw sunflower seeds, because when you cook them and you roast them, you destroy the vitamin E, because vitamin E is very sensitive to oxygen and heat. Okay, fattier fish like halibut, salmon, shrimp, sardines, lobster, and it's also in the leafy greens, the spinach, chard, kale. It's in eggs, it's in avocados, it's in olives. So those are just some common things. Of course, vitamin D is the sun, fish oils, eggs, cheese. But other than that, let's say you're not eating any fish oils or eggs or cheese because you're in a low-fat diet and you don't get much sun, and you're going to have low vitamin D levels. Vitamin D is necessary for the anti-aging process. Okay? So what I'm going to do now is I just want to double check just to make sure that there's I'm answering any questions. So someone says they love sardines. Cow's milk allergy. Well, if you're allergic to, milk, not a problem. I've given you a list of other things you consume as well. Dandelion greens for vitamin A. Yeah, well, the problem is the plant sources for vitamin A, they're all pre-vitamin A, so you're only going to absorb 5%. And that is the challenge that we deal with. Now, I consume a lot of this, kale. Okay. I eat kale. I cut it, I chop it up in my salad. So that's loaded with pre-vitamin A, but see, the cruciferous vegetables have other nutrients. We'll get into that, but the point is that you need to be eating them, but you're not going to be getting the majority of your vitamin A from leafy greens because you only absorb 5%. Yeah, I'm sorry. Okay, let me just check these questions right here. Did you say BJ's has good Kerrygold? Yes, BJ's does carry the Kerrygold in bulk. So yes, tuna is fine. I know there's some problems with mercury, but I think there's certain type. I'm actually going to do a video on tuna because there's certain types of tuna that are actually good and some tuna that is not good. I'm going to do a complete video because I don't want to get into a side thing on that right now. Fermented cod liver oil is the best, and you can get that online. You can get it from Amazon. I do take that. It's pretty good. I was given cod liver oil when I was a kid. Lasted until Easter. Yeah, it's really good stuff. I found I sweat really bad without my vitamin D. Interesting. Graying of the hair, mostly after exercise. Well, that's a stress. See, one of the things that we'll get into next is stress, so I'll talk about that then. Can you get enough vitamin D from foods? You need supplement. That's a very good question. I think you can maintain your body with just with vitamin K2 foods. But if you have high blood pressure, stiffness, you have tartar in the teeth, soft tissue calcium, you have arthritis or types of joint problems, then you're going to have to take extra. And then once you get rid of that, you can then maintain it after that. So it is possible, but not as a maintaining thing. Okay, now I'm going to show you something. See if I can pop back over here. Now, the accelerated aging of cortisol, the hormone cortisol. Here's a new word that I want to teach you. It's called catabolism. Catabolism. What does that mean, catabolism? Catabolism is a breakdown of things. It's something that breaks down in the body. Your body naturally uses the hormone cortisol to break down tissue, but with the adrenal stress hormone being activated, what happens is you get too much breakdown and not enough buildup. So you get this overall catabolic effect. That means a breakdown effect on the muscles, specifically your thigh muscles in the quad group. So when you get up from a seated position or from a chair, it might be difficult to mount this to get up. Also, the skin is very thin and almost paper-like, and I'll see that with people. I'll look at their skin and you can just see it's like very, very, very thin. That's the problem of excessive cortisol with stress, and they're losing their collagen. You also have a disappearance of elastic fibers, and that's why your joints get so brittle all the time as you age, and that's just one of the effects of cortisol. Now, I did a whole seminar on cortisol. That was the last seminar I did, and I talked about stress. And if you did not see that webinar, go ahead and watch it, but I will give you some tips on stress right now, because I would say one of the biggest things that ages people is stress, specifically losses. Loss of a person, loved one, loss of a job, loss of a marriage, threat of loss, financial threat of loss, bad economy. All that will add stress. And so you do have to constantly work on reducing cortisol. There's a couple of nutritional things that I recommend for cortisol. I do recommend the Adrenal Day formula because it has a natural B1 in there that does not, it's from nutritional yeast, but it doesn't give you a yeast infection like some of the nutritional yeast out there, and it's not synthetic. Like a lot of the nutritional yeast are enriched with synthetic. So if you did that product and you take that natural B1 with all the other things in it, it'll tend to pull a lot of stress out of your body. You feel very, very calm and chilled out. So B1 is necessary to rid stress from your body, and you'll feel a difference. How do you know if you have a B1 deficiency? There's a couple ways. Number one, you feel a lot of nervous tension in your body. You just like, you can't relax. You have a low tolerance to stress. You have edema and swelling. Yes, edema and swelling is a B1 deficiency many times as well. You have nightmares or very vivid dreams. So if you have any of those, we know it's a B1 deficiency, and stress will cause that. Another thing you can do is get space, go out for long walks, because stress tends to inhibit your space, and it's like you need to get outside and just get some space, because that calms the adrenal gland down. Here's just a picture of how proteins and different things can break down. Fat can break down, sugars can break down. It's called catabolism, and it's just a breakdown. Okay, we're shifting gears now to cancer control, because one of the things that which is aging process is dying early from cancer. I mean, there are people all around me that are dropping dead with cancer. Patients, relatives, family members. So it is a problem. And there are things that we can do to reduce the risk of cancer, and I want to talk about that. Let's first define what cancer is. Cancer is a cell that is out of control. It's duplicating at a very fast rate, and the question is why? There's a mechanism, a machine in your body that is constantly keeping these extra cells that are radically growing out of proportion in check. So there's another word I'm going to teach you. It's called apoptosis. Apoptosis. And that's basically controlled cell death. Your body is killing between 50 and 70 billion cells every single day, which they need to do that because they need to clean out all these, mutated cells, the cells that we need to get rid of so we can replace it with the new cells. So for an average child between the ages of 8 and 14, about 20 billion to 30 billion cells die a day. So that's called apoptosis. So now if we're getting cancer, we want apoptosis to work correctly to kill that cancer. So apoptosis is a mechanism that's an important defense against cancer. Okay, so that's the foundation I want to talk about. So there's certain things that destroy this mechanism and block your body's ability to kill off these cells. And there's certain things that do it, and this slide is out of order. It's called endocrine disruptors. So I want to just touch on this for a second. What's an endocrine disruptor? An endocrine disruptor is any chemical in the body, pesticide, herbicides, fungicides, insecticides, heavy metals, country and western. Just want to see if you guys are awake. That was a joke. That was a dry sense of humor. Heavy metals, country and western, this is a bad joke. Okay, so endocrine disruptors are any chemicals in the environment that alter your genes and cause disease. I have this book, it's about 3 inches thick. It's called the Modern Toxicology. It's basically the textbook of poisons, okay? The study of poisons and what poisons do to the body. We are bathed in so many chemicals, it's insane. From walking out in the yard to our food to the air, we're just bathed in all these chemicals. I mean, there's over 4 billion pounds of toxic chemicals released into our environment every single year. And that's 72 million pounds of recognized carcinogens which actually cause cancer. So our bodies are constantly hit with these endocrine disruptors. Okay? Well, guess what? These endocrine disruptors mess up the normal process of your body controlling cancer. So you may have known that already, but I'm just refreshing your mind. I'm just touching right now. I want to see if there's any questions real fast because, oh yeah, someone mentioned DES, diethylstilbestrol. Here's a tongue twister. Diethylstilbestrol was used in the 50s for morning sickness, and I think over like millions of women were exposed to it, and it caused problems not just in the offspring, but in the third generation. It really destroyed our bodies. And they did not test the long-term effects of that. Very, very similarly to what they're doing now with the GMO foods. So they made a lot of money, and then now they banned it. Okay, that's DES. So DES is called an endocrine disruptor. It destroys your hormones. Okay, so now this really amazing car called the cytochrome P450. Now this is another bad joke, but it sounds like a car, doesn't it? P450. Now a cytochrome P450 is an enzyme that has incredible capacities to turn those endocrine disruptors, those poisons, into harmless particles. Yeah, so cytochrome P450 enzymes are these special enzymes in your liver, and they're in different cells in your body that can break down thousands of chemicals, toxins, drugs, and poisons. And they basically just turn them into water-soluble particles that can go through the urine. And it just so happens that the cruciferous vegetables increase your liver's ability to make this enzyme. That's really cool. So here it is right here. Insecticides, pesticides go into the liver, and your liver, if you're eating the right foods, will basically dismantle those chemicals. So your liver is like robust. But if you have a fatty liver, or it's a liver that's a bad liver from some type of virus or something, then what's going to happen is that you're not going to get that breakdown. How do you know if you have a fatty liver? A lot of people have it and they don't know it. One of the biggest clues is your stomach being too big, and that's causing visceral fat around the organs and especially the liver. I sent 5 of my patients to the radiologist to get an ultrasound of the liver, and they all had guts, and 5 out of 5 had a fatty liver. So when you lose the capacity for liver, you can't detoxify as well, and you get a lot more toxicity. And what do you have to do if you have that condition? You have to basically start consuming a lot of cruciferous and avoid the junk. You need to get the junk out of the trunk. All right, so I just want to check the questions here. Dr. Berg, isn't it more of a function of minerals actually being in the soil before you can assume that they're part of the plant, in a plant or an animal that is eating it? Yes. Well, that's why I really want to consume grass-fed animal products, because our soils are so bad now that we need to. And that you feed these animals corn and soy, they're not getting any nutrition from that at all, and it's all genetically modified. So at least if it's grass, it's not genetically modified, and you have a lot more nutrition in the grass, especially like clover. Okay, let's go back to those slides here. Okay, the liver. Very important with your skin. If you really work on your liver and you start consuming a lot more of these cruciferous vegetables, your skin will start to change, and it'll start looking better and better and better, especially with acne and dry skin and youthful skin. I mean, the liver is really the hub of all the digestion of your amino acids, your proteins. So we're going to talk about cruciferous for a second. Let me just fix the slide here. Cruciferous. What does this word mean? Cruce, which means cross. It's basically certain plants that have these little crosses in them. Okay? And here's some examples of cruciferous. radishes, Brussels sprouts, kale, cabbage,
Mhm.
bok choy, and Swiss chard, mustard greens, arugula. Now I have some other vegetables in here too, but I wanted just to mention the cruciferous family. And this brings me to the next topic, which is going to which is a different type of nutrient. We talked about the fat soluble vitamins, but now we need to talk about the other nutrient that will not just help your skin and all that, but it will help postpone your life. Cruciferous was studied by the World Health Organization, and it was found to create some serious anti-aging effects and anti-cancer effects on your body. Each type of food is thoroughly tested to decrease the risk factors of many different types of cancer. So one type of cruciferous will maybe handle like several types of cancers. Another one will handle different other ones. Garlic is probably the top of the list. That's like the most anti-cancer properties. These are two different types of kale. Turmeric is an amazing phytonutrient. It has phytonutrients, I'm sorry. Turmeric is kind of a root that has phytonutrients. So the category of nutrients that we want to talk about next is called phytonutrients, plant chemicals. These are different than vitamins and minerals and amino acids. They basically are natural plant chemicals that have extra health factors and properties. So they'll actually help with macular degeneration, prostate cancer, many disease states. And so the question is, why aren't we eating these foods? I mean, very few people consume these foods. Here's some good ones: parsley, cabbage, and sea kelp. Sea kelp is great for minerals and iodine, but these are the foods that I consume on a regular basis. If you don't consume them, you need to start doing it for your liver, and your skin will start to change as well. Even though these do not contain a lot of the fat soluble vitamins, they do contain a lot of the phytonutrients, which are anti-cancer. And again, the GMO foods, genetically modified foods, are basically spreading all over the world right now. And the two big ones are corn and soy. And the animals that are consuming these are getting all sorts of inflammatory conditions. And even the pets that you have, like even the dogs and the cats, if you talk to a vet, and these animals that come in with arthritis, heart disease, diabetes, and inflammation in the gut, it's because they're consuming GMO food. When you just simply change the food, non-GMO, these things clear up. But 90% of all the GMO corn and soy go to animal feeds. That's pretty sad. So in the grocery store, that so-called natural chicken that you have from Purdue, it's all GMO. Unless it says organic, it's GMO. Now, what is GMO? GMO is genetically modified organisms, and what they do is they actually have them resistant to the herbicide called Roundup Ready. And so you can spray more of the Roundup Ready on these crops. And so you bet they do that. And it's the Roundup Ready, the chemical name is called glyphosate. And glyphosate is pretty nasty stuff. But of course they say it's safe, so I think it might be okay. There's this French researcher. By the way, that was just a sarcasm. Sometimes people don't get my dry humor. I don't think they're safe. But there's this French researcher who did studies, animal studies on glyphosate, and he found some serious problems with glyphosate. And I'm going to send you the link too. It says that GMO and glyphosate causes tumors, liver and kidney damage in rats within a week. A smear campaign was mounted by the biotechnology industry with scientists, primarily plant biologists and not toxicologists. And they basically forced this study to be extracted from some of these journals. So here the study comes out saying that GMO is bad, and then it instantly was retracted. Not because they didn't find a cancer link, but their reasoning was it was inconclusive because the type of rats used were prone to tumors. So now, here's the thing. If they can do that, you know that they're so powerful. They are so powerful. So, I mean, this is totally political. So the point is that you know the GMO food is pretty bad. If you look at from 1992 to 2012, you can see how many millions of pounds of glyphosate is being put, or GMO plants are being created. And you can see corn's going up, soybeans is going up, wheat. Actually, some of the wheat is genetically modified. Cotton, certain vegetables and fruit, rice, grapes, alfalfa, pasture and hay, other crops. Oh my gosh, it's just kind of going up. It's just crazy. So what happens is these chemicals, GMO foods, herbicides, they can mimic hormones. And they go into your glands, the thyroid, the ovary, and it can go into the breast, the uterus, and cause cancer. So if you take a look at, like they always say that disease is so mysterious and no one knows what causes this. Take a look at any of the toxicology books. They will list all the diseases and tell you what pesticide or chemical causes this illness or this cancer. And they don't really, like you said, Leslie, they do not connect the dots. They don't connect toxicology with cancer and natural things. Everything is like their own island. And so it's very obvious to me that all these things that are related to the toxins, and we don't actually, we're not making the connection there. Of course, we have psychiatrists like Stephen Barrett, whatever his name is, pushing out there that, oh no, that's fine, just keep eating the stuff. I just released a video. I was on Sports Talk Live, and I had a dietitian and her husband, who's an MD, get on the air and give me a hard time about the whole water myth. So you can watch it on my website, but it was ridiculous. They're like, oh yeah, the tap water's fine, it has minerals, keep drinking it, everyone's dehydrated. I'm like, yeah, okay. All right, so let me just see the next slide here. Okay. The hormones, like estrogen, from the environment, and all these endocrine disruptors act like estrogen in the environment. They actually block the thyroid function. So endocrine disruptors basically are chemicals that mimic estrogen. And that's why females get way too many cancers in the areas that they have receptors for estrogen, which are breast, uterus, and even the thyroid. African American women have a lot more receptors for estrogen, which gives them a different shape, and that's one of the reasons why even African American women are getting more cancers than other cultures, because of the estrogen. So you really need to increase your cruciferous, make sure you don't consume things that are, make sure they're organic, hormone free, because it's going to create a problem sooner or later. So I just wanted to put this slide up. I had it created. You can see, if you go down the grocery store and you see these incredible, like, delicious cookies and donuts and breads, it's all the same ingredients: high fructose corn syrup, hydrogenated oils, chemicals, high fructose corn syrup, artificial flavoring. It's all the same thing. It's pretty sad. So phytonutrients, those are plant-based chemicals that have all these really amazing properties and all these different plant chemicals that do many things. Like even vitamin A, for example. Vitamin A is not a single vitamin. It's a whole bunch of complexes. Like there's over 600 parts of vitamin A. So if you take a synthetic vitamin A, you are not even getting close to what you should get. And that's why I'm very much against synthetics. So cruciferous vegetables help protect the cells from DNA damage. They help inactivate carcinogens. They're antiviral, antibacterial, anti-inflammatory. I mean, they create all these wonderful benefits. Now I'm going to check the questions here. What do you think of wild yam? Well, if you have a problem with hot flashes with menopause, I think that would be something you should take, because it's a natural source of it's called phytoestrogens, which are actually will help you. There's some other ones too called the clover leaf. That's actually very good as well. Let's see. Okay. How much a difference will it take to take a cruciferous supplement? Here's the thing. It's always best to consume the food, but it is hard to get that. So what I'm going to show you is the cruciferous product that a lot of you are already taking right now. And of course, you probably have not been taking, because I've been out of it since March. But I wanted to explain kind of a combination of ingredients that I'm just talking, but I'm not even showing this image here. Okay, so you can see right here, there's a product that I created. It's called the organic cruciferous food, and it has organic beetroot, Brussels sprouts, collard green, organic asparagus, organic kale, organic parsley, and parsley is probably even has more vitamins than kale. And then we have organic red radish, cabbage, garlic, and turmeric. So those are all the things that I personally think are the superfoods, and I put them in one combination. There's 250 tablets in this, and this is something that is convenient if you don't have all the different variety of nutrients, because it is hard to get all these nutrients. So like it has all these products in there. It has sea kelp, because some people wig out because, oh my gosh, there's cruciferous, it's going to cause a deficiency of iodine for my thyroid, I'm going to get a goiter. No, you're not. I put the sea kelp in there, so it's a really awesome product. And in these webinars, I always give people a discount if you wanted to get some cruciferous. The bottle is 250 capsules, and I have some good news and some bad news. What do you want to hear first, the bad news or the good news? Let me see what you guys say. There's a delay in this thing. Okay, Leslie, do you want you want the good news or the bad news?
Bad news.
How about the good news? How about the good news?
Good news.
Okay, good. The good news is that I'm giving you a discount on this product, $10 off. And here's the coupon code, and here's the link. And the good news is that it's almost in. The bad news is not in yet. It's in tomorrow morning. It's coming tomorrow morning. So, but the good news, it's almost in. And I've had people wait since March for this product because here's the problem I ran into. It is almost impossible to find a local farmer or something in the United States that has the soils that I want to get these products, unless you go to China or you go to some other country. I don't do that. So it's taken us forever. And so what will happen, this is March, let's see, March, April, May, June, July, August. Is it August or September?
September.
Okay, that's 7 months I haven't had this product. I'm getting it tomorrow morning. It's coming tomorrow morning first thing. So what happened is it would have like one ingredient tested it would have too much lead in it. I'm like, I can't do that. And the next one would have like too much, I don't know, another mineral that we don't want in there that's toxic or something like that. So we had to thoroughly test every single ingredient and make sure that it's all really, really high quality from the exact farms that I wanted it from. So it's finally done. So the good news, it's almost here. The bad news, it's not quite here. And so there's some more bad news, which I'm going to tell you right now. The other bad news is that the cost of this product went up severely. So I have to increase it a little bit more. It's like going to be $5 more. But the good news is if you wanted to get the product at the lowest fee, you can actually buy as many of these as you want with on this webinar. So that's the good news. So you don't have to pay the bigger fee if you don't want. So you can get some reserve if you want. The only catch-22 is that I only want you to order this tomorrow morning, not tonight, because I do not want to sell you this product unless I am 100% sure it's available. Even though I'm tracking the guy who's like pulling up in my office. I know what state he's in. He's going to be showing up tomorrow. But until it shows up, I'm not going to take the block off my website. So in other words, no one can really buy it until I actually have it in hand. So if you wanted to check in early in the morning, and if it actually everything works, then it's in. If it doesn't work, then you know it's not in yet. So I just want to let you know that I've been really behind the scenes trying to get this thing out for a long time. So the good news is I'll have it in tomorrow. There's a 99.99% chance. But the bad news is it's a little bit more expensive. But the good news is you don't have to pay that because I'm giving you a discount. So anyway, this is a good product to take for your liver. It's the best anti-aging because it fortifies the inside of the body, and it also protects against a lot of different types of conditions that people are at risk just from the pollution in the environment. So now what I want to do is I want to give you a link and a code, a coupon code. You can just highlight that coupon code and just just save it for tomorrow, and you can go to my website and get a discount. You can get as many as you want. I will be increasing. I mean, the price has already increased, but if you use that discount, which is going to be good for the next 3 days. I know it says the offer ends in 1 hour, but that's not true because I don't even have the product in. So no worries on that. Okay. Now, if you are watching this as a webinar replay, just realize I already have it in. Okay, because I'll have it in by tomorrow for sure. Someone says, can I piggyback on an auto ship order with my wheatgrass juice? Yes, I think you could do that, but you may want to call my office with that. How long is the coupon offer? For the next 3 days. How long is the shelf life? The shelf life is good for a year, but I think it's actually longer than that. But we tell people a year because we're being very conservative.
Mm-hmm.
Someone says, don't go too commercial. I'm not going too commercial. Don't worry. I'm just, people are asking me. I'm giving them a discount. Can you provide the price of the whole cruciferous food? Yeah, the price was $34.95. Now it's $39.95. But there's 250 capsules in there. But the problem is that the price trying to get these ingredients is just off the charts. Even if you go look for a cruciferous product, it's hard to find all these cruciferous, and you may find them like in broccoli or something like that, but it's only like 90 pills, and it's going to be the same. It's like $30. It's the same fee. So it is a good program with the quantity that you're getting and the quality as well. Do you ship to Canada? Yes. Do they lose any vitamins when they are processed? Well, you're not going to lose that much with the processing, but if you keep them in the heat and keep it open, you may even want to keep it in the fridge to have them last a lot longer. What is the dosage? How many pills per day? It depends. If you want a maintenance dose, I would take 3. But if you want to correct something, you want to take 6. Personally, this is just my own opinion. If I had cancer, I would take 15 a day.
Wow.
I have a lot of people that just take them for weight loss, but that's just because it improves the fat release on the liver, and it allows the liver to function better, which is really connected to actually the thyroid being working better. So it doesn't actually burn fat by itself. What if you have a thyroid problem? Well, we have sea kelp in there, so you have the iodine. That's not going to be a problem. Is it safe to take if you're pregnant? Absolutely, because there's nothing else but those ingredients. Can I give it to my toddler? It depends. If he's like 1 or older, just give him maybe 1 a day. But of course, if it's a baby, you're not going to give him that, unless he can swallow capsules. Yeah. So so anyway, I covered a lot of data, a lot of information. I'm going to send everyone a link to all these slides because I have a lot of references that you can see, and I will send it out probably a little bit later on, probably in the middle of the night. It'll go to you, and that way you can see the webinar. I mean, all the slides, and I'll send you the webinar replay too if you want that. But I want you to apply some of the information that I shared tonight, and I want to thank Leslie for being on, to sharing her story of the wonderful example of trying to get some help of treating one person at a time, or one condition at a time. So thank you very much. Next Tuesday, we're going to do another seminar, and this one's going to be on energy, and it's going to be really awesome. I'm going to cover the topic on insulin very heavily. You need to see that if you have any insulin problems, and even if you don't. If you are fatigued, you need to come to this webinar as well. So I'll show you some techniques as well. I'm going to show you an acupressure technique that will literally increase your energy. Yeah. So I'm going to demonstrate it right in my office right here. And then you can do it on your friends and family. Just don't mention my name. No, I'm fine. You can do that. So I want to thank you guys for showing up tonight. And I will see you in the next webinar. So I'll send you a link on that too. And I will have someone reply to a lot of your questions, because some people are having specific questions about this and that. So I'll try to answer those, or go to my blog. But I want to say thank you and have a great evening. And thanks, Leslie. We'll see you next time.
Thank you.
You're welcome.